Hello, beautiful people. My presentation is for April Stress Awareness Month, and it makes a transition to May, which is Mental Health Month. I want to explore a little more the importance of stress for health and more specifically for mental health. And I want to give example, personal, of me and my mom because it's important for medicine to look at each individual and what factors are contributing specifically to their condition. Although I have experience from patients and from what I have read. And my question for Stress Awareness Month, we know that stress is very noxious for the health of the organism and can cause disorders of different systems. However, why does stress cause one condition in one person and a different condition in another person? I think this is an important, difficult question to answer, which will help us to design better treatments. And I think this is very complex. For example, stress may cause eating disorder, anorexia nervosa. I have had anorexia and I used to diet a lot as a teenager and then as a young woman, and my dieting started as a teenager due to the pressures of school, of finding your identity. This is how I explain it to myself. And the desire to be beautiful, thin, and accepted, and to fit into the current norms of beauty for society. My mom, on the other side, she has an eating disorder. For her, it is bulimia. And she eats a lot whenever she's stressed. Whenever she's worried, my mom can eat a very big quantity of food. And she says she wants to stop, but she can't. And so both my mom and me have an eating disorder, but in the opposite direction. As my dad said, it would be good if I eat a little more and my mom eat a little less. And what are the factors contributing to this difference? One factor I think is the social environment that an individual grows up in. For example, my mom thinks that she has bulimia because when she was a child, 9 years old, she grew up in World War II and there wasn't always enough food, and now when she's grown up, she always thinks of food as valuable. And she resorts to calm herself with food. Whereas, when I grew up in my family, there was always a lot of food, and I wanted to be thin, but my parents wanted me to eat in order to be healthy. And so for me, food is a punishment. However, I also think about food. But if I do, I accept it as something that I should stay away from and to satisfy my hunger, I cook, and then I like to offer the food to a loved one. And so I think it's very complicated to design treatments for such conditions that are entirely human using animal models. Because in animals you can't model the social factors. Another example to give is, for example, that stress may cause periodontal disease. But why does it cause periodontal disease in some people and not in others? Is it because of their genetics? Why does stress cause Alzheimer's in some people and causes, for example, autoimmune disease in others? Maybe if we know better the genetic composition of an individual, we might gain insight into their predisposition. Maybe even factors such as when a person is born might influence their susceptibility to disease. Because although we want to think that we are not so connected to our environment, in reality we are. For example, my zodiac is Aries. I'm born in April, and for Aries it is known that their head is the strong point and at the same time the vulnerable point. And for example, stress immediately causes in me periodontal disease. So maybe that's because of my zodiac in the time that I was born and the influence of the planets. And so I think that if we understand better these factors, we would design better therapies for each individual. For example, for eating disorders, there might be some predisposition in genetics connected to food, the food preference, but then in which way it goes, whether it's anorexia or bulimia, depends on factors of society, of upbringing, and the individual temperament. And so for this, I think that we always have to examine each patient very carefully to understand as much as possible what is going on, their history, their family history, any comorbid conditions, in order to design better treatments. And I'm continuing the research on this. I want to look what is known in the literature, but I thought this would be a suitable idea to bring up for National Stress Awareness Month and for Mental Health Awareness Month. And with the efforts of so many people, I hope we will be able to design better treatments for stress-related disorders and for mental health disorders. Thank you for your time and attention. Be well.